So good afternoon, everyone, and welcome to this grand round at the Riverland Academy of Clinical Excellence. I'm Dr. Amy Mendham and a senior researcher here at RACE, and I have the pleasure of introducing you to two amazing academics that are working within our region. Before we get started today, I'd like to acknowledge the Aboriginal custodians of the lands and waters in which we're meeting on today. I'm sitting at my home on Coorong land, which is in Berry, and we'd like to pay respects to their spiritual relationship with the country and acknowledge that their cultural beliefs are an important focus of their past, present, and their future. So firstly, I'd like to introduce you to Dr. Nicola Parkin and Meekah Zangari. They are going to be presenting on the Riverland Interprofessional Student-Led Placement Program. Dr. Nicola Parkin is a lecturer in rural health at Flinders University, and Meekah Zangari is a senior clinical educator and physiotherapist that is based with us in the Riverland and working for the Mallee Coorong Local Health Network. So Nicola and Meekah, thank you very much for joining us today, and I'll get you to share a screen and introduce yourselves further.
I'll get started by doing my own acknowledgement of country. So I'm here in Berry on Coorong country, and Nikki comes to you from Ghana country. And while you're listening and learning on country today, we encourage you to reflect on the traditional learning practices that have taken place on these lands and waterways for thousands of years. And I want to thank the Coorong and Ghana people who are responsible for the knowledge of country that persists today. Over to you, Nikki.
Thank you. So we're here to talk about the Riverland Interprofessional Student Placement Program, and I just want to start by giving a sense of what's behind this so that you can kind of situate it. So there's quite a lot behind it, and you can see what it's quite an integrated and, or we should say, complex program. So it's actually delivered through funding from the rural, sorry, I'll get all of them up, the Rural Health Multidisciplinary Training Program, but it is delivered in a conjunction with the Flinders University Rural and Remote Health through University Department of Rural Health, together with Riverland Murray Coorong. So, but while it is a little bit complicated, because while the Flinders University Rural and Remote Health discipline, if you like, or group sits under the College of Medicine and Public Health, the program itself is serving students from the College of Nursing and Health Sciences. So it does get a little bit complicated. So we got a special chunk of money, a grant called the Expansion Grant from the Commonwealth, and the idea for this program is that it meets a number of deliverables. So it's about multidisciplinary health training, it's about supporting and building capacity for clinical supervision in rural areas. We also provide placement accommodation for students to make that possible. It's also, this program is about Aboriginal leadership and support and local health outcomes for Aboriginal people. But the kind of main thrust of the program really is about employment opportunities, not just for people supporting running the program, but for the students who graduate from the program as well. And integrated into all of this is providing an evidence base for the model. It's quite an innovative model and quite a unique model. So we're building evidence around that. And so I'll hand over to Meekah, and Meekah will explain how the model actually works. And then I'll come in at the end and say what we're doing to actually build that evidence base.
So I first commenced in the role as the Senior Clinical Educator in April of 2024, after the departure of an OT who'd been in the role for the first 12 months of the program. We had a part-time clinical educator, Chelsea, who was an OT, and she started with us in May of this year. I'll get you to flick over to the next slide for me, Nikki. So the model, it was developed in 2022, and then the student-led clinic commenced in early 2023. The clinic is predominantly located at Aboriginal Health and Wellbeing Centre in Barmera. So we've got the speech and OT students. So they provide services to preschool age clients that are facing developmental challenges, and there's an emphasis on joint service delivery. These clients are typically seen for an episode of care and are provided an end of care report. Without this program, these clients would likely sit on extensive wait lists for general services in Berry. Instead, they are seen in a culturally safe environment. They are seen much earlier than they would otherwise have been, and their intervention and referrals are actioned quite promptly. We've got physio students as well, so they service the adult outpatient physio clinic and a group gyn within the Aboriginal Health Centre. So this was based on the feedback of the perceived need of community. Our clients typically present with a variety of musculoskeletal and persistent pain presentations. And students also facilitate a group program in the general clinic, which combines education and neuromuscular exercise to improve joint stability, reduce pain, and restore confident movement in people with hip and knee osteoarthritis. All services provided by our students are free of charge to the consumer. So the student-led clinic essentially means students are tasked with the provision of healthcare services to all the clients that attend their clinic, in addition to scheduling and admin tasks to run the clinic successfully. So under my guidance as the clinical educator, students get to clinically prioritise what clients should be seen. They get to identify any assistance that might be required for the client's attendance, so whether that's carer support or transport support, and then they work closely with the Aboriginal health team to make sure that everything's booked in and planned for. Thanks to Nikki, I've got some student quotes throughout this presentation that she's collated throughout her evaluation. So a previous OT student stated it was the most learning and growth they'd ever had on a placement. It was so student-led, and they got to come up with their own ideas for the session that worked really well for them. The model also has a strong focus on interdisciplinary learning and intervention. So although every discipline has its own summative grading tool, around 80% or more of what is actually assessed and graded is universal across all of those disciplines and grading tools. So these areas are, to me, what truly define us as clinicians, and students get to learn from each other's skills in communication, documentation, clinical reasoning, professional behaviour, and service management. Currently, the speech and OT students are delivering a minimum of 5 joint sessions together per week. And this has further, I guess, promoted that interdisciplinary learning as the students are learning assessment skills, the way they plan sessions, and then actually their intervention and knowledge strategies from one another to provide a more convenient, efficient, and holistic healthcare service. So as one student reflected, the biggest takeaway for me professionally was the multi-D aspect and those additional things that just don't get touched on in the course. I've already used some of those things since I've been back at work, which has all just come from being able to share discipline knowledge. We also had another student that emphasised that student peer support systems work well rather than just being isolated by yourself in a placement. You've got other students around you and you can all develop your clinical knowledge together.
Meekah, I'm just not sure I'm on the right slide here, so let me just have a look through.
No, that's right. Go back to
It is?
the cultural learning one. That's fine. That's where
Okay.
we're up to. Since the model focuses on improving, there's a particular focus on health outcomes for Aboriginal clients, we prioritise providing students with opportunities to develop their cultural responsive practice. So we have weekly cultural learning tutorials. They're led by local Aboriginal tutor, Dan Mitchell-Matthews, and he covers student topics with the students like Aboriginal cultural safety and intergenerational trauma. Students also get to complete a driving tour out to the local Mission Gerard and the government and non-government organisations in Berry. A highlight of the placement is a 2-day cultural immersion camp we have out at Calpram Station. So our students, they get to tour the riverbanks, they get to learn about traditional practices of the Coorong people and the cultural significance of flora and art. They also get to meet with local Aboriginal community groups. They get to yarn and gain really powerful insight into the persisting effects colonisation has on our local Aboriginal people. A previous OT student shared some really insightful feedback about her cultural learning, how cultural learning, influenced her placement. So she stated, I've never been exposed to working with Aboriginal people. So I was quite nervous going into it, I'll be honest. Yeah, I didn't want to say the wrong thing or offend anyone by accident, but it was incredible having those cultural workshops and being in that Aboriginal health space as well. Just having yarns with the people who work at the Aboriginal clinic was really good. And yeah, I just learned so much from them, just how different the whole system works. So the clinical educator model allows students to have dedicated clinical learning time and tangible feedback on those universal skills that I discussed earlier. So I'm not having to, balance my time with my own clinical load, which has previously reduced student learning opportunities on other placements. Having an interdisciplinary clinical educator also reduces the clinical hours that are taken away from all of the understaffed disciplines. I do believe, though, that discipline-specific supervision is still a really important aspect of a clinical placement, and therefore the speech and OT students have around an hour of supervision per week with a discipline-specific supervisor, in addition to around 2 to 3 hours of supervised clinical time. Students also have the opportunity, while they're still on placement, to shadow clinicians in other clinical areas of interest. So we work as rural generalists here at Riverland, Mallee, Coorong, and our service provision is across the lifespan. I think it's really important that students get a taste of that when they're on placement, so they can see all of the awesome opportunities that we could provide to them as an employer. Students also, we spoke a bit earlier about the cultural education on site. So it's really unique that we get to offer a local cultural education experience that's integrated directly into their placement program on site. We spoke already about some benefits of interdisciplinary peer learning. And a previous student on RISP has stated, it definitely opened my mind to going rural, being able to see a little bit specifically of what the OTs do there. A generalist role of OT appeals to me, how they can dive into every area a little bit rather than just specifically one area. And we are really proud of the high quality recruitment outcomes that we've had from this program over the last 2 years. So we have employed speech pathologist Pietro Trenton in Murray Bridge and Emily Close here in the Riverland. We have also employed Dimitrios Kondoprios as a physiotherapist in the Riverland team. So it's been really great to have them on board and see them transition into professional practice and be really valuable members of our allied health team. We've also, there's a previous physio student and OT student who have also secured local jobs in the Riverland region, but with private providers. So since the commencement of RISP, we've hosted 30 students on the program, 11 physio students, 10 OTs and 9 speech path students. This is an additional 250 weeks of allied health placements on top of the existing placements our workplace was already providing. In the last 2 financial years, in the adult physio space, students have provided a total of 393 physio services. 135 of these were in a one-on-one outpatient appointment setting, and 258 were gym group visits. So 80% of these services were with consumers who identified as Aboriginal. In the paediatric clinic, get you to flip over. Yep, beautiful. In the paediatric clinic, students have provided a total of 383 services. There were 296 therapy sessions, 58 of these being in an interprofessional therapy session within Aboriginal health. And in the last financial year, 63% of speech path and 89% of OT sessions were with consumers who identified as Aboriginal. So with anything comes some challenges. Every student that commences placement comes with different skills and life experience, and some students do require a significant amount of support I guess, with their clinical thinking and reasoning to achieve a passing grade. This can sometimes require additional discipline-specific supervising and mentor hours, and therefore challenges, I guess, that main principle of the interdisciplinary placement model. And it also puts additional pressure on our already very understaffed departments. At times, we can experience higher non-attendance rates in all of our clinics, which reduces the number of clinical learning opportunities. Another challenge, I guess, is the current model does not support interdisciplinary learning amongst peers for the physio students, and differing allocation of placement block length and starting times, etc., makes it difficult to forward plan and coordinate some interdisciplinary components of the placement. So in summary, the program has shown some early signs of success and we've achieved all intended KPIs. Within the last 2 financial years, we've provided over 770 student-led therapy interventions with a strong focus on Aboriginal consumer engagement. We were really excited to win the Excellence in Aboriginal Health Award at the recent RMC Awards night in June. Unfortunately, I was sipping a cocktail on a beach in the Greek Islands, so I was not present to accept the award, but I was really happy that my Aboriginal health colleagues, who are such an integral part of our program, were present to accept it. Over to you, Nikki.
Thanks, Meekah. It's an awesome photo. I love it. We should just Photoshop you in. I'll whiz through. I don't need to spend terribly much time, but I guess just to say that evaluation and research are integrated into the program. So overall, when we started, we agreed with a steering group that there were 4 questions that were really interested. Where is the natural energy? What changes over time? How and why? What is necessary and important? And where is quality? So we had a really open questions to just go in. So all of this is under ethics as well. So we have begun with documenting the students' experiences. So I routinely interview a deep dive with all the students, those that consent when they exit the program, and this has given us absolutely heaps of really, really rich information, which is fantastic. So one of the things that kept coming up consistently, I just wanted to point this out, was the learning that they were getting from the cultural learning component of the program. And there were 4 really big things: this confidence of working with Aboriginal consumers, really practical strategies for providing culturally safe care. The one that I love the most is seeing the health system from the Aboriginal consumer perspective. And Calprum, the experience of going to Calprum was really opening. One student said that it induced deep thought for them, which I thought was really nice. So it's probably clear to you, and it was certainly clear to us, that there was an awful lot going on in this placement. We've got the Aboriginal learning component, but we've also got the interdisciplinary, the student-led and whatnot. And so we became interested in actually focusing in on these different and overlapping and sort of simultaneous contexts. So we asked the question, one of the questions that we asked was about the context itself, and on the understanding that attention to those contexts for students is part of their learning, and really the main reason why we've got the program in the first place. So we have published a paper on this, and I just want to quickly go through some of the really interesting things that we found. So these are the 5 contexts that we identified as being the main ones. We've got the interdisciplinary, the clinical skills, the rural, the Aboriginal cultural, and also student-led service context, and there are probably more, and from the students' perspective, they've got their own context that they bring as well. So all of this is going on at the same time, and interestingly, the students would all come in focusing to begin with on a particular context, and then noticing, of course, that there's a lot more going on. We did find that the experiences at the intersections of those contexts had really particular unique pedagogical value, and we were really interested in that. We also found a couple of different kinds of learning experiences that students were talking to us about, which we called trans-contextual, because they really sort of went across the whole thing. And this is where things started to come together for the students. So one of the big things that came out, and this not for all students, but for some of them, was that they developed this expanded frame of care, and what they came in with was different from what they left with. And they're real success stories. I mean, it's really about, even though the placement may be short, using that time to really grasp all of those learning opportunities and transition from say, a particularly clinical paradigm into much more of a relational paradigm. There was also a great deal of personal growth and transformation, because with a lot going on like that, and much of it for the student who might be living away from home for the first time or whatnot, you know, there's an awful lot of growth and personal transformation that goes on as well. And often those two things were in tandem, the expanded frame of care and the personal growth and transformation. So we thought about, you know, what could we do if we wanted to actually bring these findings forward into practice. And I guess this represents a next horizon for us, is working with the clinical educators to really explore some of these ideas. So one of the ideas is that we can really hone in on the idea of context and make it more explicit and bring students awarenesses to it and get them to identify those contexts for themselves. And then one of the things that, of course, when you become aware of context, is that you can inhabit a particular context or particular standpoint, and then do that work of seeing what's going on from that context, but then seeing how it kind of changes the way you think about the other contexts as well. And we heard students talking about this, you know, being able to see things from the health system from an Aboriginal cultural perspective was a context shift. So we thought that that would be worth exploring. And also, we don't know whether this can be induced, but we're really interested in what are the conditions and supports that might actually support students to have that sort of convergence across the context, that sort of synergistic process. And there are two theoretical lenses that we propose would be worth looking at more carefully to support this. One is transdisciplinarity, which is beautifully described by this little quote, the necessary togetherness of disciplines and knowledge systems, which is a principle that's already established in practice. And I guess what we've done is we've unpacked it. So this is an opportunity to sort of to synthesize it again. And then also complexity itself, which like complexity is a huge knowledge field, but there's a framework that we really liked called Xenophon, which is a Welsh word, which describes, it sits under that complexity paradigm, and it describes how experiences that can influence us in ways we may not fully understand, and that they're non-linear, that they're about emergence and unpredictability, which perfectly describes the, I guess, the situations that the students are in the on placement in RISP. So we're interested in exploring that a little bit further. But we've got lots of other threads that we're following as well. We're following the thread of the cultural learning curriculum and documenting that, because there's something really interesting going on there that would definitely be worth documenting and reporting. It's so impactful for the students, so it's really a matter of kind of making that available outside of the program. Also, there's a lot of really unique activity patterns that happen in the supervision and and education and support because of the model, and so we are planning to document them. To follow the students as well, to see where they end up. That's really important. And to do all of this work as much as possible with the practitioners, so that it actually supports more scholarship of practice within the program and in the local area as well. So that's our sort of next steps. And that brings me to the end of my bit. I know we've only got 4 minutes left, but Meekah and I would like to thank you and ask you if you have any questions. And please feel free to follow these 2 QR codes. One will take you to a RISP video, which is quite nice, and one will take you to the paper. And feel free to contact us on those emails. Thank you.
Fantastic. Thank you for your presentation. It's really nice to hear from start to finish and the evaluation process. We've got a couple of minutes. Are there anyone in the audience who would like to ask a question? I'll give you a couple of minutes because I have a question. It's around scalability of the project. So this is very specific to what's happening in Barmera. What are your thoughts on expanding this and how well it can be implemented across in another LHN?
Shall I go on that one? I think one of the things that makes this model work is that, or this placement itself work, is that it is absolutely based on the context of where it is. So it's place-based and it's responsive to the local needs, and it works with the capacity of the workforce and so on. So you couldn't necessarily pick it up holus bolus and put it down somewhere else, because everything has to be really growing out of the local context. But I think that there are some things that are particularly interesting about this program, and I guess that's what we're trying to identify with our research, is what is it that's going on here that may be a principle or maybe transferable or maybe something that is worth kind of trying somewhere else and maybe adaptable to other contexts.
It's fantastic. Thank you. Any other questions from the group? This is perfect timing and a perfect way to finish it, actually, place-based education. Wayne.
Yeah, just as CEO, I want to congratulate both of you for your involvement in the project, which Daryl and the team got to receive the award for. So clearly the Greek islands would have been terrible, but congratulations all the same.
Thanks, Wayne.
Thank you.
Well done. You look like you've been on holidays.
Yeah, slightly tanned.
Yeah. Well, thank you everyone for joining, and we look forward to seeing you in the next race grand rounds.
Thanks for the opportunity. See you.
Thank you.